Next, I want to call on Dr. Bill MacEwan to come forward. Dr. MacEwan is a psychiatrist and is the only member of his profession who spends 4 days a week seeing people living in the downtown Eastside hotels. He does this as part of his outreach for St. Paul's Hospital. He's a director of the schizophrenia program, the early psychosis program, and the complex disorder program for our health system. Please welcome Dr. MacEwan.
Thanks, Joy. Nice to be here. I do get the opportunity to wander the downtown east side. I go 4 days a week. It's a lot of fun. There's a website that I'm on. If anyone wants to come around, it's a very interesting thing to be part of. I go into hotels, the single-room occupancy hotels. I go into the shelters and virtually try and find people who are in need of help and are not able to get the help. So I want you guys to think about, amongst all of you, I don't have to have a raise of hands, how many of you know somebody or have personally felt troubled, depressed, anxious, not doing well? Large number. How many of people who abuse drugs or alcohol or know somebody who does? Again, a large number. How many know somebody who's homeless? And it's a much smaller number. And why is that? Why are people homeless? I mean, there is the aspect of the unfortunate circumstance that people will get into, and they will find themselves homeless due to being out of job, out of employment. And Rich Coleman and the Social Services and Development Ministry are doing a great job of providing more housing. There's really been some positive things happening there. The housing stock is going way up, and they're also trying to help provide meals, as Gabor references. People are not getting enough food. Those are good things that are happening. Those tend to deal to the aspect of what we like to think is our Western sort of small L liberal philosophies of there, but for the grace of God, go I. Meaning that if we happen to fall on bad times, we'd be down there homeless. It's just not true. The majority of people who are down there didn't have a hope in hell beforehand. They came from people who had drug abuse or fetal alcohol problems. They were abused, as Gabor was mentioning, as children. They've had head injuries. They often have HIV, HCV, and about 40 to 60% of some of the people we're seeing. They have schizophrenia. They have other psychosis and other major psychiatric illnesses. They have post-traumatic stress disorder, and they have substance abuse. So these are people who I don't want you to think of, they're just like me, I could be there any day. And the reason I don't want you to think of them that way is because it does tend to move you towards, okay, what are we going to do for these individuals? How are we going to help them? The theme has to be you want to take care of the majority, the people who need homes and shelter and food, that's a good thing. But you need to take care of the people who are the most seriously ill. If you don't take care of the most seriously ill, the people who are not as seriously ill will not benefit either, because there's a subgroup, probably about 3,500 to 4,500 people in the downtown east side alone who are not getting any adequate help by psychiatric help, medical help, substance abuse treatment. And those are the people that it's a hell of a lot of fun to go out and be with them and be involved with their care. And that's what I like to do, because those are the people that we need to really try and help deal with, because those are the people who come into our emergency departments all the time. They have what I call the $2,500 office visit to a doctor. They're picked up by the police. They're taken in by ambulance. They go to St. Paul's, which is $1,800 a day per diem, and then they end up being discharged within 24 hours with no follow-up care. We need to try and deal with those individuals much better. So I think the key feature here is to think of the second order question. So when Rich is there saying, we've done all this kind of housing, the question you want to ask is the one that Jim Chu asked of him. Okay, what if they're too ill to be housed? What if they're too violent? What if they're too disordered? What if they're too psychotic? They use too many drugs? What do we do then? Because Jim Chu and the VPD are the only backup we have in that situation, because they're outside of that realm of what we could consider acceptable behaviors. So we have to ask that second order question, how do you deal with those individuals? This is brought to mind for me yesterday. A patient of mine, Brad, went to the center of the Granville Street Bridge center span and jumped off and passed away. I talked to his mom from Ireland this morning. Not an easy thing to do. Brad was an individual who had lots of life. He was a white kid, and he used to do some great reggae and hip hop stuff. But he also was very disordered. He had a drug problem, a serious drug problem. He was a nasty guy. He attacked people. He was aggressive with them. It was very hard to house him. He had very serious schizophrenia. We did not succeed with him. Our health system failed him. But I always want to think of that individual and say, okay, what can we do for that individual? Because if we help him, we help all the other people who are in need of help but are not suffering as severely. So please ask that second order question. What do you do for the people who the general sort of housing and other health measures and meals would help with? Thanks very much.